ENT can be very overwhelming because you kind of feel deceived when you start studying it. Ear, nose, throat, head and neck surgery all embedded into one. Globally, all exams, whether Indian competitive exams, foreign exams, PLABs, USMLEs, everything, image-based questions are increasing. Clinical application-based questions are increasing. So you cannot just hide behind books and words. In terms of textbooks for your third year professional exams, your basic textbooks like the Dhingra, or I recommend the Hazarika, is good enough. It has adequate detail. ENT, definitely they're doing that because I am aware of the patterns that are happening towards question submissions for these exams. Hi everyone, my name is Dr. Jagadish Chaturvedi, your friendly neighborhood ENT teacher, faculty at PW MedEd. How do you prepare during your third year ENT subject? So as a student of the professional exam, ENT can be very overwhelming because you kind of feel deceived when you start studying it कि यार 3 सब्जेक्ट एक साथ डाल दिया और 2 पार्ट तो बताया नहीं. Head and neck. So ENT, ear, nose, throat, head and neck surgery all embedded into one. So it is basically 5 subjects into one in addition to your other subjects that you have in your final years. So it can be very overwhelming and it's very technical. So ear, the nose and throat, lot of structures inside you can't imagine, right? So many people think that nose is only this much and pointed upwards, and you realize no, nose is actually quite a big structure, very, very, deep. Similarly, ear structures are hard to imagine. So that's why it becomes little more difficult to quickly grasp ENT among so many other subjects. So what should you do? How should you go about studying ENT? Now with the next coming, and also globally, all exams, whether Indian competitive exams, foreign exams, PLABs, USMLEs, everything is becoming very clinical application based questions, and ENT are very, very common clinical conditions. Whether you choose to be an ENT or not, you will see patients with ENT problems because they are so common. Ear, nose, throat, ear block, runny nose, sore throat, very, very common. Everybody has it, right? But also there are complex ENT and airway conditions that we should know in emergencies as well. The only way I would recommend is when you are in your third year, start looking, try to cover the spectrum of all the clinical conditions in ENT possible in your medical college. From the ear, cover all the common conditions like especially, otitis externa, fungal infections, discharges from the ear, safe type of CSOM, unsafe type of CSOM, malignant otitis externas, otosclerosis, the common ear conditions. Try to get as much of clinical exposure to it because your exam questions are now becoming very clinical application oriented. Even your vivas, even your answers that you have to write are all clinical management steps, identification, diagnosis, management, all of that, right? So nose also try to cover common conditions, allergic rhinitis, sinusitis, mucormycosis, and also a lot of other growths, juvenile nasopharyngeal angiofibroma, and all of these things that are very commonly asked. Adenoid, tonsils, head and neck conditions for tracheostomy and growths and masses, all of these things. I mean, like that, the whole ENT is important, but I'm trying to say get as much of clinical visuals. All right. Now, the biggest challenge that you have is that when the professor or doctor is seeing in an otoscope, you're not able to see. So try to get a chance to see in the otoscope or use any commercially available video otoscopes or endoscopes where you can examine the patient and look at it. What we are trying to do in PW MedEd is, because I have a big library of endoscopic images, we are sharing a lot of them in our notes, in our videos, so that you start getting used to what the eardrum looks like, what these diseases look like inside the ear, nose, and throat. Otherwise, there are lots available on internet, on YouTube, on many social media sites about what these ear, nose, throat conditions look like. So don't just limit yourself to theoretical textbooks, but try to get as much as possible of visual clinical images of as many diseases, because image-based questions are increasing, clinical application-based questions are increasing. So you cannot just hide behind books and words and remember, E. coli ma, 3 C's are like this. All this mnemonic wala business is going to get you lesser, chances of becoming, cracking these exams, versus your clinical orientation is going to help you more. That's what examiners want nowadays. They want to create doctors who have more sound clinical application knowledge and not just theoretical rattu gyan. So that is why, along with that, there are our notes. We have comprehensively put a lot of notes, a lot of PYQs, very detailed teaching, very slow teaching. The live lectures are going extremely slow, step by step, so that if you are not able to catch that in other sources, you can catch it over here, and also giving you a lot of clinical images. In terms of textbooks for your third year professional exams, your basic textbooks like the Dhingra, or I recommend the Hazarika, is good enough. It has adequate detail for you to cover most of the topics. But with that topics, try to get a lot of clinical visual understanding of the same topics, what they look like and how are they being handled. Surgical steps tak पूछे जा रहे हैं, So see if you can also see certain basic surgeries, like cortical mastoidectomies or myringotomies or myringoplasties or grommet insertions, tonsil adenoid surgery, septoplasties, fess surgeries. What are the complications to them? How are they being managed? You have the entire knowledge in your clinical medical college. If you say, sir, हमारे college में कुछ नहीं होता, nobody does anything, there are no patients, it is just no resources and all of that, there are resources outside which you can venture. Go see nearby clinics or nearby hospitals, request to be a free observer, pay if you have to, but get that access for that clinical understanding, because that is where is going to make the difference in the upcoming exams, is the clinical application. Whether other subjects they do it or not, ENT definitely they're doing that, because I am aware of the patterns that are happening towards question submissions for these exams. All right, so take away, guys, for your preparation during third year, do not miss your clinics. Go and see as many common conditions as much as possible. Get all those visuals. Follow our PW MedEd database of teaching, which we have a lot of clinical images and a lot of videos that are being shown, and teaching is very clinical oriented. Try to get that along with your basic books that you can read, and you will be all set for ENT. And lastly, don't hesitate to ask questions. If your professors or your teachers, you are scared to ask questions, you can always reach out to me, and I will be happy to figure out a way to give you those answers, either through PW MedEd's classes or separately through Instagram Live and Telegram Live that we do with PW MedEd. We'll be able to answer all your questions. However silly they are, there are no bad questions. So guys, all the best, and I'm sure you'll do well in ENT. And whether or not you choose this lucrative, multifaceted field, you are definitely going to end up seeing ENT patients with your relatives. Thank you.